for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have
Hello and welcome everybody. Let's go ahead and open up those Zoom room doors and let everybody in. My name is Ruth Ellen Sanchez and I'm going to be hosting today's Daily with Doc and Becca, which is sponsored by dailywithdoc.com. And today we have an amazing guest. But before we do that, we always have to start with this program is for educational purposes only. This content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA, and testimonials are shared as individual experiences of the individuals, because I'm expecting that we're going to have some people come on and talking. So these are their personal experiences. And we do not make any income claims or regarding health or either. And you are an empowered individual. And so we're here to offer options. Thank you for bearing with me during that. Today we have Yvonne Rea, who is an amazing woman and an amazing practitioner. And she is a functional medical, what is that, Yvonne? Function med nutrition.
I was trying to shorten it. Yes.
Okay. Microcurrent pain specialist, board certified, amino acid therapy for brain health. She is former military. Yvonne has worked pain-free for life beta testing research, where microcurrent protocols are developed, erasing pain. Oh gosh, I can't.
I was also at Erasing Pain. I was their nutritional director.
Perfect.
And I ran and do run the intern programship as well.
Awesome. Well, let's just bring you on. I hate trying to read things because it always gets like too long but anyway, we're very excited to have you on today. I've been looking forward to you coming back on and talking about this for a long time. So I'm going to go ahead and let you finish introducing yourself or begin the talk.
All right.
We can ask questions too. So.
Well, let's just talk about a little bit why we're here today.
Yes.
We're going to be talking about, a new way to look at spinal injuries, whether they're caused by sports or neurological. And this can actually be applied to taking a look at new ways for all types of pain and injuries. I am starting a docu-series It is called the Microcurrent Revolution, Healing Beyond the Pill, Pill. And we're going to have several parts to that. And today I'm excited to talk about some of the spinal injury recovery that we have been able to assist using microcurrent, nutrition, and gaining strength back so that folks have the ability to do what they were told that might not happen for them again, things like walk. And that's some pretty big stuff.
Yes, well, I'm very excited to hear about that. And this is part 1 of your series. So thank you, everybody.
Well, don't quote me on that. This is part 1 of our series. I'm not sure how the producers will line everything up, but yeah, I hope to be able to come back and maybe even share, as we go through each of the various tissue issues. And I know a lot of your audience understands the different tissue issues. Now, maybe not by that verbiage, but be reminded, if we look at the 4 health categories, those are based on the tissues of the body, the primary or basic tissues of the body. And there's 4 of them. 80% of all diseases, all conditions will come out of those 4 tissues. And it's not by accident that you may not know the recipes how to help heal those tissues. But that information is out there. And that is what these folks are here to do and help you understand. And I just add a little electric love to it. And, because for some, it is electrical that carries the chemical. So if you have had a reduction in your electrical, even when, and I was one of these, taking nutrition, I got amazing results, but there were some areas that were just stalled out. And so that's what we'll be kind of focusing on today, along with sharing some stories. And hopefully I got some folks that might pop in and maybe even give us a story of their own.
That would be great. Very good. I'm very excited. All right. So I'm going to go ahead and let you begin. And I'm going to leave the screen and you just let me know when you're ready for a slide.
Go ahead, start the slide, and also any questions that may come up. This is not going to be, it'll be somewhat brief. There's only 9 slides, but my hope is I'm a very visual person that maybe somebody else will appreciate what you see.
Perfect. Right. Just give me 1 second to get the screen set up.
Okay.
All right. I have slide 1 up.
All right. Fantastic. Well, as I just said, we are electric beings. And if you take a look at Time magazine, it was New York Times magazine. They did, piece on about the body electric, and they're not the only. Forbes magazines and many others. But I just want to talk a few quick moments when we get into some of these injuries. We're going to be talking about using some very specific tools. This is not a TENS unit. And this is not your typical microcurrent that maybe you might, pick up on Amazon. These are medical devices, class 2, FDA cleared. And a couple of things that are really important to understand, like with a TENS unit, it does not penetrate the body. Most microcurrents out there will be on a different waveform than the ones that we'll be talking about today. And just showing a little bit of a picture, we're talking about, high voltage. What the high voltage does, it is in microcurrents. So we are working on the body's electrical, but the high voltage allows us to go deeper and penetrate more of those tissues. If you want to give me the next slide. Oh, that one's kind of wonky. Go ahead and give me the next one. Sorry about that. So in talking about electrical, I'm going to back up just a little bit. I mentioned briefly that electrical travels and carries the chemical. So whether or not you are utilizing, prescribed or prescriptive medicines or nutrition, or even just any food sources, again, if there is an electrical event in the body that is keeping the electrical slowed down or possibly even blocked. Now, let me just tell you a couple things that will block the electrical of the body. One is scar tissue. Two is inflammation, swelling. And the third thing is what we call affected tissue. Affected tissue means that the body, that particular tissue is not well. Everything has a oscillation. It resonates. And that would be, they've placed some numbers on that, kind of like a radio station. Everything has its own vibrational frequency. And like organs within the microcurrent realm are 90 or right around 90 hertz. If I start to oscillate a little too low, maybe I'm coming down 15 points and I'm starting to get the tissue starting to get tired. If it continues, it gets sick. If it continues even more, we now have a chronic condition that is set in. Well, that electrical, if you're ever driving in your car and you hit a puddle, it kind of bogs down, right? Because that puddle actually slows the momentum. Well, so does scar tissue, inflammation, and again, tissue that is affected. So by the use of our microcurrents, they offer biofeedback with it. We can go in and check the tissue, bring the help identify what's happening there, and then bring the tissue back up. Now, that removes a burden, but microcurrent cannot rebuild missing tissue. So I need to make that really clear. So it really does matter what you put in this pie hole. And, I am of the opinion and education now after my own personal results that we can't do this in the way that we're doing this without supplementation. Now, in our clinic, we use clinical doses, also known as therapeutic doses of nutrition, plant-based, and coupled with the microcurrent, we see even faster results. So let's just take a look right here. This is a current project that we're working on. This is after stroke recovery. We have a program here for that. And we'll just read a little bit about what's going on here. 4 years after a left side stroke, Anne here just continued to fail. She was no longer walking. She started out as a little with a walker, but slowly ended up in a wheelchair. And with that decline, the deterioration of the other limb started to take effect as well. She came into my office, someone told her about me, and we started working on her. And some of the specific complications were frozen knee, pointed toe, frozen ankle. What happened is that leg was so spastic, there was no bend. She couldn't move it. So with, and this is, she's had several therapies, Botox, physical therapy, along with numerous pieces of equipment that were, utilized that did not bring along any relaxation of the tissue. Currently, you can see in this picture, this was about 4 months working together. That knee is now relaxed. The leg is relaxed. I went in and was working with her and her doctor, and it was just very incredible because it didn't appear to her that she was going to have these types of results. Our goal is that I'm trying to get her to be as independent as possible, and we don't really know what that looks like. but the fact that, you know, she's able to bend and move her leg, lift her legs, we're looking for that next step. All right, what do you got next? So one of the gentlemen that I've had the opportunity to learn from is Dr. Dom Dombrowski. And they call him Dr. Dom or Dr. D, and he's out of Dallas, Texas. If you want to get a hold of him, contact me and I'll help you do that. We also have others like here in California, towards Southern California, that have these devices. Dr. Ken Holt. Again, contact me and I can help you get a hold of them. But here we had a patient with a cervical contusion. It was a gentleman that fell off his ladder, and in doing so, he hit a fence and injured C5. Now, they were very quick about this, and time does matter in the time of the recovery as well. So they went in, there was actually complete loss of upper and lower limbs. Ultimately, there was a number of things that were applied, including the microcurrent. There are a couple different protocols that we use on that. And then the client purchases a device, takes it home so that they can have daily use to regenerate along with supplementation. And then at some point, we put them in a strength building program. Because remember, if the nerve's not working, it could be a very long time. And if there's no electrical going to that nerve, remember, your nerves supply the electrical. And I do want to mention, I've had people ask me, there are different kinds of nerves. There are A, B, and C nerve fibers. And part of what they delineate is if it is myelinated, if the nerve is myelinated or unmyelinated. And then, of course, the diameter, is it very thick? Is it thin? Now, this is important to understand because when we start to talk about nutrition for this specific tissue issue, it helps us understand here it is a myelinated issue. And so because it's myelinated, myelin is made up of something like 90+%, I've seen variances of cholesterol and your good fats, minerals, and water. So if you are someone who is struggling here, and I'm just going to have you take a look at, you know, your own numbers, but get that myelination back onto this tissue, and you're likely to be able to see even faster changes. All right, what do we got next? Oh, and so anyway, he ultimately regained normal gait. He became ambulatory again, and you know, life is much better. It did take a full year before there was complete recovery. And you got any questions for me, Ruth Ellen, yet?
Not yet.
Okay. Here is another, this past project with Dr. Dom. So we're looking at transverse myelitis. If I remember correctly, this one is about the gray matter of the spine. This too would be one that is myelinated, and thus the myelinitis, itis being inflammation. So we go in there, we treat and affect the inflammation and the swelling, and then we flood it with circulation and high doses of nutrition. Think about this. We're using a device that can get us anywhere from 300, 400, I've even seen numbers of 500 times faster blood flow to the tissue. Do you think if what you put in the pie hole can get through the tissue, let's just use the 300 times faster, that tissue can heal even better? So no matter what device you're using, if it's bringing about circulation, make sure that what you put in this mouth is wellness, not illness. And there might occasionally be one other factor if we're not seeing the expected results. And that would be sometimes there's, a body that really truly needs some heavy detoxification. And I had the opportunity to work with the Detoxification Center, Dan Root and his dad, Dr. David Root. And if you don't know anything about their program, I just encourage you to go look it up. But that would be one other thing. And he's doing amazing work in his clinic as well. Back to this TM. So this person was in a wheelchair for about a half a year or a year, presented again, it was with this weakness along the spine. And so what happened, and I think somewhere in a future slide, we've got some pictures, but you'll see that outside of doing a couple very specific tissue issue with our magic wand here, we then place pads. And this one again was very pretty quick. Within the first 4 days, they had a change, and then was able to walk within just a couple weeks. What is your next slide? So along with some of the things that we're doing, we're also, and I'm sure many of you have heard about vagus nerve stimulation. You can do this not even with our devices, but again, if you're taking in good nutrition and you do vagus nerve stimulation, you can affect, if we take a good look at that picture, and I don't know if we can blow that up or not, but that is cranial nerve number 10. Cranial nerve number 10 innervates every single organ in the trunk. So whether it's tapping, and there's many, many things you can do. You can bounce along the side of your bed, bounce on your furniture. All of these things can begin to impact the vagus nerve. This is something else that we do within our protocol, specifically as we're talking about the spinal injuries or the stroke recovery, simply because we do know that there is a brain-gut axis, and I personally call this the frontal spine, because it does and offers and touches everything that the spine in our back touches. So I think that this is an underutilized nerve, and the more that we learn about it, and I just really give credit to Dr. Rob Van Bergen. He did his thesis on this, and if you get an opportunity to read that, just incredible, just how that alone can make impact for all types of injuries. Next. Earlier, we talked a little bit about that white gray matter. And if we take a look at it, can you see my mouse? Is my mouse impacting anything? No, probably not. This would be a cross section of the spinal cord. You can see clearly the gray matter and the white matter. So again, we're talking about myelinated, unmyelinated, and then when we talk about A, B, and C fibers, it really will be about the dimension, the size of the nerve as well. And with the spinal cord, everything gets fed through there. So if there is low voltage to these tissues, we feed it nutritionally, we bring along our tools and devices to start to open up any of that electrical, and simply we do a test, measure, and correct. So the goal is to raise that voltage of that tissue. and continue to feed, and then we can walk into that next stage. I've shared this story before. I'm not sure if I've shared it here, but we had a gal who had been in an auto accident. She was in a coma for 4 months, came out. 41 years later, somebody suggests that she come see me because she had a foot drop. And within about 4 months, that foot drop had completely changed. It's kind of fun. When she came to me, she was falling 4 to 6 times a day. And because her arms didn't come out to catch herself, she was re-injuring, because oftentimes she would hit her head again and again. Maybe it was about 2.5 months. She was walking and she had a glass in her hand, and she said, "Yvonne, I fell today. And as I was falling, I set the glass on the table," and she fell and her arms came out. But not only, because one of the other things that we're doing is we're working with proprioception. Proprioception is huge. Athletes know all about proprioception, but it was about that eye-hand coordination, which was also very challenging for her. So some very exciting stuff that we can help with. And that is potentially, just potentially life enhancing. Next slide. All right, here's another project. Now this one is the transverse myelitis. Didn't I already talk about this one? I think my slides might be out of order. Or did we just talk about the spinal contusion?
I'm sorry. I thought I had put them in order because I just downloaded them and I can't. Let's see.
Let's just go to the next one.
Okay, this is like.
So we've been through them all. Oh, there we go. That's one of them right there.
Sorry.
That's okay. Thank you. Yeah. So, here again, talking about, the arms unable to come forward. That was one person. This particular gal had a stroke, and for 4 years she was declining. This was one I think I mentioned just in the beginning. But if you take a look at the picture that shows where, after we do a couple protocols with our tools, we got her started on all the nutrition. I'll tell you, that alone made a ton of changes. But you'll see where we've made some pad placement, and that's very crucial. And what we did is literally we're just flooding the area, reducing the inflammation, and then now where there's atrophy, we are just enhancing the circulation. And we've got the upper extremities working. She's combing her hair. She was not able to write at Christmas time. She could not write and fill out her Christmas cards by Easter, or even before Easter. She was doing that. She folds clothes, she does dishes. I mean, she's doing all of these upper body daily activities as we continue to work on the lower limbs. And so there's just a few things. I think I've been talking for enough time. And Marilyn, if you have some other questions, just let me know. And I realize, I think I missed a little bit. Did I talk about the ABC nerve fibers and the myelination?
No, I don't think you did. Do you want me to reshare?
Oh, no, that's okay. just, a lot of times people are not familiar. There's as far as nerves go. So part of my training has been in neurology. It's a map and it follows everything. So if you if you have a challenge, find out what nerve that is on and then follow it back up to one of the spinal nerves, but ultimately all nerves originate in the brain. So, chiropractors that are called like upper cervical, that's why they say that they can actually help improve the tissue challenges further down, because ultimately all of the nerves originate in the brain. So sometimes they're only working on the cervical, and we're kind of coming in. I come at it at both ends. If it's your foot, I'm going to give some love to your foot. I'll also give some love to the cervical area and anything else in between, so that we can gain clearer pathway and get blood flowing. And again, remember, it is the electrical that travels the fascia that carries all of the chemical reactions and responses in the body. So if it's slow, this may be one tool that you could try to get restoration, get some recovery.
That is amazing. I just am fascinated by all of what you're talking about. I mean, I had to have surgery, and it disrupted several nerves. And so I understand how long that can take to regenerate and connect. And it just blows my mind how, without telling anybody anything, but how one set of nerves is attached through the fascia. And if that gets disrupted, then you can't really read what you're doing on your muscles at all. Like, I'm literally having to learn how to connect to parts of my body that got disrupted. So it's amazing work. I need to come and see you for sure.
Yeah, we'll take our little tools and we'll apply to the area. And then I always follow that map. It is simply a map. It's a map like what Dr. Wallach put together with the 4 categories, with the nearly 100 essential nutrients. It's we're not guessing. Also with our tools, at least on the electrical, we can go in because it's a microcurrent with biofeedback. We can see the tissue issue. We can see the amount of voltage, how healthy the tissue is or isn't. And then we can go in and try to help move that either up to or down from, an angst state.
Nice. All right. So AJ has his hand up. I am going to bring him on the screen with you. Let him ask his question.
Hi, AJ.
Hey, Yvonne. How are you?
I'm fantastic. It's good to see you.
Good to see you as well. Thank you for all that you do. I have a number of questions. So get ready. First and foremost, let's start. So you said blood flow to the tissue 300 to 500% more efficiently. I'm paraphrasing. So,
and that's according to the company.
Okay, I'm not going to debate that, but what I am getting at is, number one, what device will do that, or all your devices capable of doing that? Number one. Secondarily, is there a way to target the whole body at one time, or is it just, so what's the recommendation?
So when we're talking specifically about spinal, we're targeting first some of the very specific tissues involved, like the gray white matter, the nerves, the other nerves and nerve endings of the extremities. So we've got to get several things up and going. On occasion, again, there's a whole brain connection. And so we do also work with that. And then most of my tools, I have several frequency type tools, whether it's scalar, terahertz, all of them offer specific uses. The latter that I just spoke of, those are really beautifully targeted about the blood and helping clean the blood, because like I've heard you and many others on your show talk about dirty blood. So I've got some that will be very specific to the blood, but not necessarily increasing in blood flow. But with our microcurrent with biofeedback, yes, at these specific settings, we can increase blood flow. Stanford and Baylor did some testing, and like I said, I've seen a couple different numbers, but between 300% and 500%.
Okay. And then, so is the mechanism of the electrical charges, is the mechanism to increase electricity, or is it to increase blood flow, bringing nutrition? What is the mechanism that heals?
That is super fun to know. All of it. And, what we can offer with these prescriptive devices is, I'm just going to show you this screen real quick, if that's okay. Let me get over to a mode that shows us biofeedback. And I, touch my skin, and just a moment. So if you tell me if you can take a look here.
Oh yeah, can't see a thing.
Let's see. Okay,
Try tilting it down. Try tilting it down.
And actually, I'll give it just a moment. The light goes off after 10 seconds. And so now you should be able to see it.
I see 136, 102, 37, 65, 1.
Yeah. So see that 6.5?
Mm-hmm.
First of all, that tells me that's the XY cofactors. That shows me that I have a block. See that 36?
Uh-huh.
That's information about the health of that tissue that I just touched. Mm-hmm. And then one is a timer, the other one is power. And then if you see the one in the lower left, that actually shows me, just like an ohm meter, and this is going to clear in just a moment. It started out at 19, just an FYI. I'm touching my wrist, and that should go off.
5, 4.
Now look at that 6.
Uh-huh.
So that tissue right here at my wrist, I did have a motorcycle accident. Okay, it just went off. I'm down to a 2, still a 6. It'll come back up for you to see. Still at a 2. Here we go. So it's showing me in real time how the tissue is not only affected, but how it's responding to the treatment. Now, what I'd like to see is that 6 clear. But if I don't, it's okay still, because what I'm doing is from the tissue to the brain and back. It's called a closed loop neuromodulation. Many biofeedbacks out there do an open loop. So you bring the brain's attention to the affected tissue.
Okay, didn't really understand a thing, but I have one last question. So, and I understood. I'm just joking. So, well, not last question, but one additional question. I have a woman who had lymph nodes taken out, and does a lot of not draining lymphatic well, the lymphatic system not working well, and always gets swollen legs type of thing. Is there something electronically, or is there a device that you think might give her some relief or assistance?
Absolutely. But I would also be looking at other tissues regarding the swelling. It's not always the lymph. Sometimes it's a heart, sometimes it's a kidney. There can be more than one causation. So we do an extensive history.
And she's I'm familiar with metabolic syndrome issues, and we've done a lot of B vitamins, de-stress, those sorts of things, and Ultimate Daily Classic, and she's using longevity lymphatic support. But I think that maybe I can set up a call where you can maybe chat with her and go into in depth.
Sure, let's see if we can't find her some easy relief. Worst case scenario, she would have a non-invasive tool that she can keep her symptoms down and restore voltage. We do know if they've removed anything, there will be scar tissue, there will be swelling, that tissue is affected. And so you want to address those things. And then we'd find out, if in fact that was from the removal, or is there something more going on?
And if folks wanted to contact you, what phone number would they use?
Our office line, if you want to send a text, let us know that you saw us here, and is 916-990-8907.
Excellent. Thank you. All right. So we do have somebody out on Rumble, Pure Being. And let me move this so I don't have to turn my head so far. Says, glad to be here. Yvonne is amazing, and I've been blessed to know her for many years. Glad you're having her on. So thank you. She's amazing. And glad to hear. Oh, wait, I think I duplicated that. And then she said something about a spinal contusion. And it was kind of broken up because she was responding to what you were saying. And then, have you noticed certain types of clients or conditions respond especially well to the Aveza microcurrent device compared to others?
Yeah, so I have used and tested others, and I would say that this one by far, there's not another one out there that offers biofeedback. Now, there's Russian devices out there, and this was initially developed simply because of the Russian devices. But with Tim Smith, who is the engineer behind it, a couple things that are pretty darn spectacular are, you got a dual split chip, which allows us to do more than any other one I've seen. I think the protocols, I have trained with others, both that use the Russian device as well as some of the other American devices. I've trained with them simply because their perspective, if they're coming at it as a chiropractor, as an MD, we have so many. I wish I would have had some of these, some of my eye goggle, but eye health. We've had ophthalmologists that are using these for everything from glaucoma to cataracts. Both my astigmatisms are gone. My eyesight, if you've ever heard me tell this story, my glasses were a 4.0, and then after using the nutrition and the microcurrent and listening to Dr. Ronald Pugh, if you guys remember that one, he challenged Dr. Wallach to 25 legally blind patients, and they all had varying degrees of sight restored. So my eye health went from a 4.0 to a 2.5 today. It is still at a 1.75. And I don't know if I'll ever not wear glasses. partly because I'm a hit or miss on my own protocol. But my eye health is definitely improved simply by you understanding my prescription is coming down. It had continued to go up for years. When I started the supplementation, that halted it and kept it there. But then when I started the microcurrent, I've been going down. So the two together have really initiated. And I want to say for Pure Being, I don't know if he was able to come on, but I got the opportunity to work with him. He's a detoxification center, and to work with some New York police and New York firefighters that were at 9/11. And anyway, I just want to give them a real shout out because they're doing stuff kind of like me. I mean, I'm not seeing anybody else doing what Dan Root is doing. So thank you, Dan, for saying hi.
Yes. Thank you. All right. I always get a froggy throat. And he says, please tell Yvonne it is Dan. I guess. Thank you, Dan, for saying that. And then Yvonne on YouTube is saying, or I'm sorry, Olga, please forgive me. What is the difference between small home microcurrent device for facial treatments and the ones Yvonne uses?
Well, for starters, it's going to be the depth that it reaches. The second thing is the voltage. So that would be the depth. Next, it will be the waveform that it's on. So our tools, both the home and the clinical, these are on what's called the sinus wave. So everything of nature, plants, animals, ourselves, we are on a sine wave. We recognize that when we see an EKG, right? Most all other microcurrents are on a man-made, like a square wave, a sawtooth, a triangular, or sometimes they'll layer them on top of each other to make greater impact. And it's not that they can't get an effect, but most of those are not on a microcurrent. They're on a microcurrent, but they don't have the voltage for the depth. So you can certainly see some changes. And there's a couple other things. One would be that we have the reactions technology, which is the biofeedback closed loop neuromodulation. So we are literally going to engage the brain with the tissue. At some point in our journey, the tissue said, like for me, I had a motorcycle accident, my back, and I was taking prescriptive for way longer than it was ever prescribed for, but they kept giving it to me. And I felt great during it, but I think ultimately I continued to have greater injury. I herniated the disc. It's now 2 years later, and it had stretched and is now pressing on 2 inches of my spine. I went to go stand up and couldn't stand up. So with these devices, what they not only allowed me to do was to find the root or the problem after the healing had occurred. And then, I mean, you can register it. It's registering, and it engaged my brain. At some point, my brain said, Yvonne, talk to the hand. We got work to do. How was it that I had all of that going on, and yet I could get up every morning and go to work? I had a commander who he said to me, he said, yeah, I heard about you before you got here. And this was at Oakland Naval Hospital. You were supposed to be this stellar, person, sailor. And, I'm not really seeing that much from you. My spine was being crushed and we didn't know it. And so I would go to work, do my job, and come home, go to work and do my job and come home. And I know some of you guys are doing that, and they're, just anything else. But when we begin to open this up, this will make a change. Nutrition made a huge change.
Yes, it does. It definitely helps a lot. All right, we have Marilyn with the question. Yeah, so let me bring her on. Marilyn?
Yes, hello, Yvonne.
Hi,
Wonderful to
Marilyn.
see you. We were talking earlier before the show. Our distributor, we have a longevity distributor named Bill. It was the Avazio device that
Avazia.
okay. And so he can rent it. He rents it now from you, or
Well, Bill took the step and wanted to get one of his own because he saw what was possible. And rather than spend his money on continued renting, he is now part of the family, and he's actually getting himself trained as well. So we're really, really excited to see the many, many changes that are occurring with Bill.
so this gives biofeedback but it also emits frequency for the healing?
Yes. Yeah. We can detect, we can measure, and we can treat. It actually, I'll even go a little bit further just to tell you, and this was really about you. Anyway, it's like a 5-in-1 generator in the fact that I can use it as a microcurrent. I can add on through this little opening other tools like, here's one. This is one of a couple different types. This would be a pillow. So for PEMF, so now pulsed electromagnetic field, I can resonate tissue specific, nerve, bone, whatever, tissue specific. And this will drive about 8 to 12 inches into the body. Now, some people have a very, very large pad of these. So earlier, AJ asked about the whole body. There are devices out there that are really spectacular, but most of them are set on one of about 4 to 6 settings for circulation, for relaxation, but you cannot control much more than those few settings. I think the hertz are 10, 30. I saw one with 12, and then there might be one that's a multi.
There's one that's real popular called the Beamer.
Oh, yes, I own them.
Oh, okay. So
yes,
okay,
yes,
so
and I own, and we have the new generation Beamer here as well.
The Cloud, yeah, it's called the Cloud.
Yep.
Where can I get more information about
fantastic
this?
tools, but these are very different. They do not engage in your electrical system. Let me make that very clear. They do not engage in your electrical system, but they are providing you a PEMF therapy, which we've seen great results, not as swiftly, but many people will feel it, and I did as well. Yeah, and if you want to reach out to me, I can tell you about some of those and get you in touch with a regional distributor, and that might be able to help you out.
Okay. And I don't really know what you mean when it says it does not engage in the electrical system. Because isn't that what it's really doing? That's what I'm hearing.
No, it is not. It is permeating a waveform into, like when I hold it like this, I can work on chest, lungs. I can put it behind my back, work my spine. And then with our tools, we get it's tissue specific. I can turn this right to spine, right to bone, right to nerve. This here actually will engage into our electrical. Let's see, I'm right here. But a PEMF cannot. It will enhance the area that it's in. It's going to give it a better setting. And remember we were talking about oscillation in the beginning? So imagine if you walk into, so I work at Radiant Light, and I walk in and the space is filled with scalar energy. So scalar is very calming to everything. With PEMF, you're enhancing the environment. You are not working, you're not actually engaging the body. But when you enhance the environment, have you ever walked into a space and maybe it was too loud, there was, too much of these other things, and you kind of felt angst? That's just impacting the environment. I hope I'm kind of saying that pretty clearly. And if we ever need to do a PEMF, while I use it, I'm not a complete expert, but I think you guys might have even had somebody on that is.
Well, my
Yeah.
husband had a stroke, so I was just looking for a device for him. What would be the best device for him?
Well, if you already own those, absolutely use them. If you don't, for the same, almost the same cost, you could literally, first of all, work on the tissue of the scar, because that was an electrical event. And then you can start to work on the individual areas that have been impacted. And we're going to flood it. We're going to reduce swelling. We're going to increase anything that is starting to atrophy. And I got to use, starting to tire too much.
Okay, fantastic. And AJ did a scalar scan for me, and I thought it was utterly amazing. 10 pages telling me I had too much silver in my body, or I needed vitamin K, or I needed to eat pistachios. It was amazing in 5 minutes. And he said he learned it from you. So I would highly recommend that for anyone, the scalar scan. I thought it was utterly amazing, and it gave me so much insight to my own body. Like, it says if you have parasites, if you have toxicity from fertilizers, all kinds of stuff like that, in depth. So fantastic. Thank you.
Thank you,
Appreciate
Marilyn.
it. You do.
Thank you so much. Okay, and we have one question in the chat. It is, okay. I'm sorry, it just disappeared on me.
Is that the arrhythmias?
Yes. Do any of these devices work with heart arrhythmias?
So let's just talk about that a brief moment. There could be a couple different causations. If the causation is structural, meaning that you have that nerve that's being impinged and it'll be coming down the spine, yes, we can kind of go in and start to open up and drop that swelling so that there is no impingement on that nerve. And it's very clearly marked. There'll be areas that are very clearly marked along the spine. I would do vagus nerve as well as work the spine for that to see if maybe that is in fact the tissue issue. Unless you've been told that there was something else going on, that's where I would start.
Perfect. Thank you. And Bill has his hand up. So I'm going to.
But at a very minimum, start, if you're not already doing the nutrition, that's a given. Okay. And anytime, that's always, remember, microcurrent, none of these tools, scalar, can rebuild missing tissue. They're going to begin to remove burdens from your body. And then what you put in this pie hole, again, is it bringing me illness or wellness? And you got to do it in clinical doses. If you've ever been to my classes or seen my classes called Size Matters, my size matters next to the next guy who may be larger or smaller. So we want to be sure that we get in enough of the clinical dosage, not your store shelf dose. Remember, they don't actually, FDA guidelines tells them what they can and cannot say on that bottle. So we're always talking about therapeutic or clinical doses here.
Yeah, it's very important. Dr. Wallach always says, if you treat everybody like an animal, treat us like dogs, because if a dog is 5 pounds, you would give him one kind of amount of medicine. And if the dog is like a 50-pound or 100-pound dog, we have a friend of mine has a really humongous dog that comes up to my hip, and that dog would need different amount of medicine. So we have to keep that in mind. And you're right. If we don't give our body the building blocks, the things that are going to help, the mortar and everything, then we can do all the different treatments that we want, but we need to feed the body's ability to make those changes that we want.
Yeah. Yeah. And if you're on nutrition and it's not helping you, find a different brand or look into the possibility that maybe you've got a little electrical slowdown or block, and that's different than an energy block. Let me make that part very clear as well. Some, do what they call energy clearing. That is actually different than electrical. We're literally coming in to raise the voltage of the tissue. All tissue has a healthy range of voltage. And when it drops or when it gets too high, that tissue is going to be angst or tired or sick. And so the goal is to bring it back into a closer to normal range. If we can engage the body, if it's been long-term, things are going to happen even faster.
Yeah.
Simply because when the brain's involved, healing happens faster.
Yes, it does. All right. So, did you have a hard stop today? I forgot to ask. Normally,
I did not.
what is it, AJ?
Barbara D has a question about spinal stenosis.
Okay.
Barbara, unmute yourself.
Bill has had his hand up. I'm happy to ask Barbara's question. Barbara, if you can unmute yourself, go ahead, and then we'll go to Bill. Where's she?
So are you ready for me now?
Yes, go ahead.
Yeah, so my husband was diagnosed with spinal stenosis, and I was just wondering if any of these modalities could help him.
So your first modality definitely will be nutrition, because that spinal stenosis, as you probably know, is narrowing of that inside of the bone, right? So that narrowing will begin to impinge upon the other nerves. And then depending upon where the narrowing is, and if it's on the right side, left side, straight down the middle, what it's going to impact is what happens. Ultimately, the nutrition, so the body puts up its own scaffolding. It's still, remember, connective tissue, which under the 4 health categories actually falls into hard tissue. So, do the recommended for hard tissue, but then yes, you can come in, use these tools for a couple different reasons. They would help. Part would be inflammation. 2 would be increasing circulation. Also, we have on our prescriptive devices, there's a bone stimulator. And so now you can make things happen even faster, the regrowth of that.
Wow.
Excellent, thank you.
Yeah.
That is amazing. We got to talk about that, because I have somebody in my life that needs that. All right, Bill, if you could unmute yourself and ask your question.
Okay. Great to see you, Yvonne.
Hey, Bill.
It's been a little bit.
I hear you.
Okay. We're good on the sound?
Yes.
Okay. Hearing Yvonne starting in June, I was fascinated with this, going online to the website, Pain Free for You. My wife and I, we went and visited her in December. I had 3 treatments. It's quicker than it should have been. We should have waited some time in between, because we did 2 on the Thursday. On Friday, we did 1 in the morning, then left. It should be separated. But I had a pain level from 1 to 10. I was at 12 most of the time. And those 2 treatments for 4.5 weeks, my pain level went down to a 4. It's not just the nutrition, it's the blockage. Like we're saying, if we don't absorb it, it's not doing us any good. So with the nutrition, changed the diet years ago, and with the nutrition, we became better. So I would recommend anybody that if you possibly can, fly into Sacramento, drive whatever you need to do, and come and see her. This is a miracle device, but it's not the device. It's learning to use it. And so we are getting better and better and better and better. And then in turn, we can help others to be better. But I thank you tremendously. And
Bill, I love that you took the first step. You told me you were going to come out, and I do hear that, and that can be a big expense, but you made it happen, and you are now in. If all we can do in the beginning is change the trajectory of that tissue 1 degree, and I think we had a total of probably about 1, 2, 3, 4 sessions. 4 degrees, 5 degrees, he's already that tissue is already going to be going into a different place.
Correct. So we are changing the nervous system that has to be changed, and then getting oxygen and blood flow to the rest of the parts of the body.
Yep.
And number one thing, if you get one of these instruments, just the vagus nerve alone, clearing up the intestinal digestive system, the other side on our right side vagus nerve deals with the heart and lungs. We all need to breathe better. Anyway, thank you.
Thank you, Bill.
And, you know, he said something that I'm just, he said, breathe better. We are doing and have been doing a lung trial. And so if anybody does have chronic lung conditions, the trial, I can send you the information. My goal is to prove the efficacy of this home device as a first response to keep you out of the ER, much like an inhaler, but by dropping the inflammation and allowing you to breathe better. So far, we've been able to, we're closing in on 100, not there yet, but we have been following the tests, and 3 days later, their oxygen levels are still improved after one treatment. That inflammation in that scar tissue, you know, let's get in there and start to try to move things out.
Yes, the scar tissue definitely needs to be moved and broken up and moved out. And inflammation is so detrimental to so many people.
Yeah.
Thank you, Yvonne. I don't have any more questions that I see, and unless that my chat is like gigantic in Zoom, so it's hard for me to read because I can only read one chat at a time, and it's really long. But thank you so much. I'm really grateful, and I'm hoping after today we can set up your next visit with us and continue on your docu-series a little bit on our show. Anyway, I'm looking forward to
Yeah. And that next one is actually going to be brain injuries, and how we affect the skull plates and the sphenoid bone. And it's kind of interesting because we actually do it distally through all the tendon work. So we don't touch the brain.
That's amazing.
And but when you see some of the x-rays and some of the changes that have occurred just in the body by doing this protocol, it's pretty impressive. And some call it an autonomic nervous reset, system reset. We don't call it that because it can help realign. But with the brain injuries, it's really something else. And maybe we can even do it live.
I would love that. That would be great.
Yeah.
It would be really good. All right. So tell everybody one more time, what is the best way to get a hold of you?
Well, if you'd like to call or text, our office line is 916-990-8907. Ideally, if you go to our website, it's forabetteryou2.com, like it says at my name right there.
Yeah, right there.
And then that would be most ideal, simply because sometimes the texts and the phones, they can be lost.
Yes, email too. It can get lost.
Yeah.
Yes. Okay, so that's the number 4, and then a better you, and then the number 2.com.
Yes. And, or you can go check us out, Microcurrent Academy. Let's see, where am I? Microcurrentacademy.com. Ta-da.
Nice. Okay, microcurrentacademy.com. Excellent. I'm definitely going to sign up for your school for sure. All right. So if I could get all the co-hosts to come up and join us on the screen, then we can, say goodbye to everyone. And I'm just so grateful that you were on today, because I love this topic. I want to get you on with Tim Marsh. I want to get you guys together because your philosophies are so similar, but totally different modalities. And I think it's just going to be a great show. And AJ definitely wants that, because it's his idea too. All right. So on the screen, we have Sherry, who is part of our tech crew and helps get all the platforms set up and takes the signal that I send to her and then sends it out everywhere. And we have Phyllis, who's out on the different platforms, who is also posting everywhere that needs to be posted. And she's also responsible for Dr. Wallach getting on the radio, her and her husband, Andy. So she is, I just so grateful for that, because none of us would be here if it wasn't for all the work that you and Andy did. So thank you for that. And then Marilyn, Miss Speedy Fingers, who is typing and dictation and typing almost every single word. And I don't know how you do it, but somehow you manage to look things up and then paste them in the chat with the same time. You're very impressive, Marilyn. Thank you. And we have Albert, who is in South Africa and is our gatekeeper. And he is the person that would answer the phone in the middle of the night when we're all sleeping, because it's morning for him. And it's like 10 o'clock at night for you, right now. See, that's dedication. And then we have AJ, who's our digital marketing director and part of our tech crew as well. And everywhere that you see us out there is because he helped us get there. And there is no words for the gratitude for that, AJ. You're amazing. And then I want to give a shout out for our fearless leader, Rebecca Dukes, as she's traveling and helping out with her family. And we're so grateful to you because you helped create all of this as well. So thank you for that. If you would like to speak to a health coach, you can call 855-949-3377. And if it's the middle of the night, you're going to get out. And then if you have questions, you can email us at questions@dailywithdoc.com. And if you need, there's one more I'm forgetting. It's support, right? Support@dailywithdoc.com. If you have other questions, then you need information, then we can help you with that. Also, this program was for educational purposes only, and the testimonials of the individuals were their personal experiences. And remember, always be kind. You don't know what somebody's going through. And sometimes it's a really hard thing, but they're going to fake it until they make it and smile and be happy and joking with you and go home and cry, or cry on the way home, or cry on their way somewhere. Whatever it is, you just don't know. People are going through a lot right now. So always try to be kind. And you don't have to be perfect, but just do your best as a human. Thank you, Yvonne, so much. I am so grateful that you were here today and that I could do the show.
Thanks for the opportunity to make awareness for microcurrent.
Yes. Yes. Have a beautiful day, everybody. And we will see you tomorrow with Dr. Judy Reynolds. Thank you so much. Bye for now.
is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor.